Okay. Welcome, everyone. We're going to start in a few minutes. So, Peter, where is that background from?
This is actually from today. We're in Osterenlech. It's a little village about 2 hours from Zurich.
Are you there now?
Yep.
Wow. Beautiful.
So,
Yeah.
what time is it over there?
1 o'clock.
Okay. All right. So, we get to bed a little late tonight. We're going to give everybody like a 2-minute, time to get on because, how us dentists are. We like to run on schedule. Just like our patients. Hi, Sam.
Hi, how are you doing, Alan?
Good. How are you?
Good, good. Hi, Ed. Hi, Michael.
Sam, how you doing, buddy?
Good, good. You can still call me and check on me if Mark Weingart is retired,
Oh, yeah. We should be doing that. You're right. Everything's good. Life is good.
Everything is great.
Oh, great.
Now, the question is it colder in Pittsburgh or Rhode Island?
Who?
I said, is it colder in
Oh.
Pittsburgh or Rhode Island? Because we were talking about the weather.
I probably Pittsburgh.
How is it by you, Peter?
That's called self-justification for your taxes.
No, we had a great week so far. Beautiful blue skies. Maybe high 40s during the day, 20s at night.
Wow. Nice.
Yep.
All right. Is everybody good to get started? We're all set. So, well, first of all, I'd like to welcome everyone. We have a lot to present tonight, so I'm not going to, whoever's late is late. And you know me, I like to start pretty close to on schedule. I want to thank all the volunteer participants tonight, and I'll be introducing Michael Cohen in a second. Before I do that, I want to just share my screen and welcome our members and our guests tonight. We have quite a turnout tonight. And for those of you who are new to the International Association of Dental Specialists, we have launched our Business of Dentistry program. This will be posted on the site. Once a month on Saturday mornings, we have a business course for an hour. Different topics, mostly geared towards younger specialists, but you're all invited. Please go on the website, sign up, and welcome residents and recent graduates. As you all know, we have our cocktail hour the second Friday of every month. And we have some great programs coming up besides tonight, which I'd like to share with you. We have coming up after today, we have on March 30th, a program on improving your CBCT skills. And then Robert Fayela in April, doesn't have the topic yet, but it's on artificial intelligence. I'm going to cut short this intro. I will be posting a special offer for potential new members in the chat. Feel free to reach out to me, but I want to introduce a friend of mine, a mentor, Michael Cohen. Quick short bio that he gave me. He received his DDS from McGill University and then his certificate in periodontics and MSD from the University of Washington. He was in private practice for 43 years before devoting full-time to Seattle Study Club. How he did it part-time, I don't know. He founded the Seattle Study Club in 1992, and since then has been responsible for starting over 270 interdisciplinary study clubs worldwide. And one of them is mine, the Long Island Dental Forum, which I've had for 24 years. And part of that was the impetus to start iADS, having specialists come to Long Island to present once a month. I said, let's start a message board and communicate specialist to specialist. And was Michael, I don't know if I told you this, but you helped me create this, and I thank you for that. Michael has authored 2 quintessence textbooks on interdisciplinary treatment planning and has lectured exclusively over the years on that topic. And he was awarded the Pierre Fouchard Gold Medal in 2019. The International College of Dentists awards this to a person who has made outstanding contributions to the progress and standing of the dental profession. And with that, I want to thank you for being the moderator, master of ceremonies, whatever you want to call it tonight. And thank you for being with us, Michael.
I'm happy to be with all of you this evening. The theme for this evening's session addresses the question, is the collaborative team approach to patient care in jeopardy? I think there are many of us sitting here tonight that hope that that's not the case. I believe in some ways it is in jeopardy, and yet in others, possibly not. One of my mantras has always been that we can't control what's happening in the world, but we do have some control of what's happening in our own worlds. We as specialists are faced with more and more challenges in being able to provide collaborative interdisciplinary care for our patients. Some listening in may have a different focus on the type of care that they provide that isn't interdisciplinary, but still high quality. But for those who believe in a collaborative approach, the myriad of reasons, there are a myriad of reasons for our challenges. Referrers may not truly understand the benefits, or they may understand, but just don't feel that it's necessary. General practitioners, as we all know, have expanded the scope of what they are willing to tackle in providing what they deem appropriate and acceptable care for their patients. This includes more complex demands. Much of this is rooted in the belief that to stay busy and to become more profitable in practice, this shift in caregiving is necessary and even essential. And of course, the DSO situation where many of the DSOs are bringing the specialty services in-house. There are many specialists amongst us who have been facing these challenges, but have also figured out ways to continue to remain profitable and to thrive. Each has their own way of dealing with these obstacles, but one of the common denominators is providing high quality continuing education in concert with an environment conducive to meaningful, helpful collaboration. This takes place, I think, every day in our Seattle study clubs in the US and globally. This evening, what we've done is invited 3 of our directors who are from Seattle study clubs to share their views on the sustainability of referrals for the future. We will be entertaining the perspectives of a young director, young in practice and young in his club compared to some of the others. Dr. David Lee Hill from North Carolina. Someone who's been doing this, I would say, medium to long term, Dr. Peter Tin from Maine, who recently received the Seattle Study Club of the Year Award, and from a veteran director who's been a close friend for many years from Rhode Island, Ed Katz. So with that being said, I am going to open the program to David Lee Hill and welcome him. And David Lee, you're on.
All right. Well, thanks for the introduction, Dr. Cohen. And Alan, I appreciate the opportunity to speak on behalf of International Association of Dental Specialists. I know there's a lot of friends that are on here. And you asked me if I could give a little bit of insight into what we do here in Chapel Hill, North Carolina. So I want to go ahead and share my screen. And hopefully folks will be able to take away maybe a little something that they can bring back to their own respective community. So Alan, you able to see my screen?
All
Okay,
good.
great.
All good.
So is the collaborative team approach to patient care in jeopardy? And the short answer is thankfully no. One of the main reasons that I would argue that the collaborative team approach is as present and important as ever is frankly because of what we have been able to accomplish in our community with an outreach and with an emphasis on kind of what we refer to as a grassroots campaign. And what that really meant for us is getting out and connecting with like-minded individuals within our community. And one of the best ways that we were able to do that was with our study club. Now, do I think that the study club model still works? And my answer would be the way that we ran our study club when we first started in 2011 does not look the way that we run it today. And so we've had to evolve, just as all of us have with these changing environments. And so my goal this evening is just to give you kind of a quick preview of what we've done and some of the things that have helped us. So a little bit of background, as Alan mentioned, I'm in Chapel Hill. It's a relatively small city with a big basketball school, as you guys know, population 57,000, and it's part of the Research Triangle made up with Chapel Hill, Durham, and Raleigh. A little bit about myself and our practice. So we established Chapel Hill Oral Surgery in 2011, and that was the year that we started our study club. When we started the Chapel Hill Comprehensive Study Club, it was literally an element of going door to door, knocking on doors, introducing myself, and really kind of recruiting members to this idea of having a university without walls. So that's kind of how this thing started in 2011. We've reinvented ourselves over the last couple of years. And so over the last 2 to 3 years, I think we're going on our 3rd year now, our goal was really to reconnect with the community and to get involved not only in evening meetings where we're looking and discussing clinical type cases, but also to serve as an outlet for really the needs of the community and the needs of dental practitioners that were members. So the way that we accomplished that and what we've been trying to do, one was we started a hygiene program. And what that really allowed us to do was to get kind of into the offices of the folks that we work with. And we've established some very meaningful relationships with clinical staff. And what we have found is that it's not just hygienists that are interested in this programming. We've had different assistants from different practices that have also expressed interest. So this has kind of morphed into an entity in its own, and it's been far more successful than I really even envisioned at its outset. The other thing that we looked at as we've talked about the influence of DSOs and all of the pressures that especially young clinicians are coming out of dental school and either getting into an associateship or different aspects of the business. Part of running a practice was the business academy. And so that's something we started all sort of around the same time as the hygiene program. And I would say of all of the things that we have done in the last 2 or 3 years that has made a real impact, the business academy has been one of them. It's been kind of a chance to turn the clinical side of things down. And we do this in a smaller group setting. Probably 50% of our membership are folks who are not in our traditional study club model. And we've had a lot of success with this. This is something that has become extremely popular in some ways. I would argue more popular than our study club in terms of the people that want to join us. And I think a lot of it just has to do with the fact of how much pressure people are under and trying to run their practices and being able to have a safe environment where they can share their experiences and kind of have a turnkey approach for discussing a lot of those ideas. So in terms of our overall goal and what we try to create with our study club, this is what looks different than it did in 2011. We've really kind of made a recommitment to exceeding the highest expectations of excellence. I had a conversation with a couple of other directors that have been really influential in mentoring me throughout this kind of study club journey. And the common theme that I noted is what I would call kind of the 4 seasons experience. and what it required was a reinvestment of time, of thought, putting a lot of thought process into the curriculum that we were providing, and also just getting back out there kind of on the road and reconnecting with the different providers in our community. So at the end of the day, I'm in Chapel Hill, North Carolina. This isn't New York City. This isn't Manhattan, but I'm convinced that in order to be successful, you've got to be able to connect with people. It starts with relationships, and these different study clubs have been, frankly, just an avenue. It's a doorway into being able to have these connections. So, number one, a space for networking. I think this took a little bit of a hit, obviously, with the pandemic and us having social distancing and not being able to get together. But now that we've been able to resume more normal activities, the strength that we had prior to pandemic, I think, is right there. Educational opportunities, as I mentioned, we had to really look at reinvesting our time, frankly, our resources, into bringing what we thought would be the very best educational experience to Chapel Hill. And finally, in order to be able to provide a space that was safe and challenging the members to grow professionally, I think in doing that, that's been very sustainable for our referral model, for our referral-based model. So I do think this has provided a good environment where we're able to collaborate, engage with each other in discussion. And I think being present and being in person is one of the best things about the club and about this model. So in terms of programming, I just wanted to give a kind of a brief glimpse into what this looks like for us as we're moving into our third year now doing this program known as the Complete Curriculum. What we do is we kind of take this as a stock suit, if you will, and then we nip it and tuck it, and we try to make it very bespoke for what we want here in Chapel Hill. So I'll give you kind of a preview of what this looks like for us. Here's our 2022 sessions and then 2023 sessions. But in a nutshell, what you're really looking at is a wide array of different types of programming, not just clinical based, but we have some, as you can see, some social media or social marketing aspects. We incorporated some things from our business academy into this. And of course, now with hopefully the end of the pandemic, we now have live speakers coming back, which has been a big plus for us as well. So kind of in conclusion here, do I think the members are satisfied with what we're doing right now? I think you get out of it what you put into it. There were some years, a couple of years back, where I probably wasn't putting as much effort into just the connections there that we have in our group. And at the end of the day, again, I think it's all about face-to-face interaction. It's about reaching out to these different individuals, connecting with them, providing these different learning environments. And again, it doesn't necessarily have to be through the study club. It could be through any type of educational event. We do high-tech nights sometimes. We also try to bring our referring doctors into our practice just to kind of see what we do and how we do it. And it all goes back to providing these network opportunities and some tools of the trade. And this has been a good platform within our community that's allowed us to succeed. And I do think that it is sustainable. I just think that it takes probably more effort than it did in 2011, but the rewards are there, if not even better than they were when we started the club. So I am happy to answer any questions.
I think what we'll do, David Lee, is have people who have questions write them down, and we will come back to them.
Okay,
so that we know that we can get through the presentations tonight by all involved. So I want to move from you to Dr. Peter Tain, who is a periodontist in Maine and a director of one of our Seattle study clubs. And Peter, I will turn it over to you.
Thank you, Michael. And let me just start my screen share.
You might, Peter, tell everyone where you are coming to us from. because I
Okay,
really
so-
appreciate, yes, go ahead.
So, so yes, I definitely appreciate the invitation by Michael and by Alan. And when Michael called me, that was about a month ago. I was actually in Austria, and I'm here again in Austria. But I said, no problem. So I'm a couple hours ahead. So I hope I'm not too slow with my presentation. And well, here are my thoughts. So I'm a periodontist out of Portland, Maine, and I want to say, David, I agree with everything he said. He really, you get back what you put into this, and connections. I think those are really key items. I've been doing this for quite a few years, and here are my thoughts on the subject. So we have 3 periodontists. The guy to the very left on your screen is a senior partner, and then we have a young Adam coming up, a junior partner joining practice. And on the bottom, you can see, so we have the Casco Bay Study Club, which we founded, about 2004 maybe. Corey and Tane, which is a practice, and then we have a little on the bottom right. It's called the Breakwater Study Club, and I'll get to these items because they all, it all comes together. And I put my thoughts down just like David did in a little PowerPoint presentation. It's not as refined, so just bear with me. Let me get this out of the way. So the first question, so I went through each question, put some thoughts down. Are these specialists continuing to see growth in their practice in the present environment? What's their confidence level in continuing to thrive in their practice? And, Michael pointed out all the issues that we have. Sorry, I'm having, oh, here we go. And it's really a mindset. I look at these things like DSOs, clear choice, are like Starbucks to me. I think it raises the level of awareness. It raises, it's, I'm the local coffee shop versus the big companies around us. So I think again, it's a mindset. We benefit from that. It just clear choice. Well, there's clear choice, but it just makes people more aware. We benefit from the advertisement that they do. So again, other people look at it differently, but that's how I look at things. And I also know there's an ever increasing need in dental services. And I think most of the directors are specialists, and you just really have to think about what you're doing. So we can't treat them all, but I think we need to find the patients that want to work with us, because we provide specialty care. And I think that's a message, and we have to internalize that, and we have to also make sure the patients understand what we provide, and also the referring practices. The next question that Michael had asked was, what are the advantages of running a study club, including but not limited to sustaining and or increasing patient referrals? And as Michael points out all the time, we're elevating the level of dentistry performed in our local community, and we elevate the level of patient care. And what I utilize, so that's, hang on, the previous slide is really, that's what I believe in, that's what I'm doing. And I use the study club. Oops, sorry. A little up, yeah. Really to identify the dentists who want to collaborate with specialists for the patient benefit and who believe in this interdisciplinary approach. Not all the dentists initially may believe in it, and I have some coming in, some leaving, but again, that's the message I have, and that's what I believe in, and that's how I try to find and work with referring dentists. And there's a little bit of an advantage at this point compared to David. We still do a lot of knocking on doors, because I noticed there's always, everything is changing so much faster. There's a transition from younger dentists buying new practice, DSOs coming in. I don't really, I can't keep a track of things anymore, but we have a little bit of a name recognition in the community, in the Portland dental community. So people do approach us. So that's sometimes quite nice. 24, let's see. What are we doing to maintain the collaborative referral-based professional relationship? That was Michael's third question. I think the Seattle Study Club and the approach to interdisciplinary treatment and learning is still unique. And it, I think, again, the University Without Walls, that is a concept that you just have to internalize and believe in. And it's different from other study club ideas. Everybody knows SPEAR, but I think the treatment planning, the in-person concept just sets us aside, and it makes us, and it'll continue to help us succeed. And here are a few things. Let's see. Yeah, you have to be passionate about the concept and the study club. And there's ups and downs. I think David pointed at it. It's some years life gets in the way, office gets in the way, things gets in the way. So you have to refocus. And David also mentioned Seattle Study Club. I just termed it a little differently. It's a launch pad. It just brings it all back together, and you take those tools and you work it from there. My advice is to have a well-organized and well-executed program and be consistent. David looked at, he showed us how he balances his day, his program, full day, half day, evening, hands-on. You got to be creative. You got to look at different venues. Again, it's the people you work with see you care about their patients, you care about the club, you care about what you do. So that's like a common theme. Be creative. And then I really enjoy the complete curriculum. It's a great adjunct where we can plug things in at different times. But I do feel the in-person is critical. But I love the curriculum. It's just really rounds up every year's program. Let's see, what else do I have here? Oh yeah, and then we have, as I had a new associate join us, we made a kind of like a farm league in baseball. As I said, I can't keep up with who is doing what and all the different people. So we have a simple program that we're trying to connect with young graduates and kind of see, whether they like it. It's a really simplified program. And then as they grow and mature in their skills and in their interest in what we do, we may start inviting them and feeding our study club. So I think that's a pretty good concept. We also, the hygiene study club, very helpful. It's very good just for name recognition branding, and I'll get to that. Social media, Instagram, I'm not that big on it, but definitely you got to keep it. That's where it's at. I think, I notice it's really on Instagram. Everything that we do, we post. Yes, we send emails. Yes, we send paperless posts and all this, but really, I think the most important part for us, the most effective way to communicate with our group is Instagram. How am I running on time? Yeah.
Another couple minutes.
Okay, I'll keep it going. Oh, another nice little idea, dancing with the dentists. I'm happy to share some ideas or have one of my team members help you with. It's a fundraiser for the local community, and where we invite, we train, we pair up dentists with ballroom dancers, and we have this event that's been grown. Unfortunately, COVID kind of put a dent into this, but we raised $40,000. We split it up between a couple of charities, and we had pretty much about 400 people joining it. It was a pretty fun event. So, similar, you got to connect with the community. I think that's another important piece. Yep, we're going to Austria. I mean, kind of self-serving, but it's been it's a great experience. We bring in speakers and with a core group of people, spend a week. We do some with Ed together. We have a regional meeting that was also, I think, creating a community among the directors, among, within Alan's group. And I think that's what Alan is doing very successfully. And then finally, I started this position, Director of CE and Communications, and just to have some help. It's very hard to do it all by yourself. I mean, I don't know how Michael did all this, but I think so. I kind of came up with a, job description, and I said, representing the culture, and I think the culture that we talked about, the culture of your practice, your passion for education. And it is in a way a brand, you're trying to brand your practice and not, in all different ways. And through communication with the dental community, patients, and the general public. And yes, I couldn't do this at this point without these two ladies, Sydney and Jam. So I'm happy to answer any more questions later on. And thank you for letting me present.
Thank you, Peter. And we'll move on to our seasoned director, Dr. Ed Katz from Providence, Rhode Island. And he has been doing his Seattle Study Club almost as long as I've been doing the Seattle Study Club. Maybe not quite, but pretty close. And at any rate, I have great respect for him, not only as a director, but as a clinician. And so I'd like to turn it over to Ed.
Thank you, Michael. And thank you, Peter and David. What I've got to say really just simply reflects pretty much what they've said. I don't have a screen up, so I'm not sure if I'm in the entire screen or if I'm just up in the corner there. Alan, you can direct me if there's anything I need to do to expand the screen.
You're good, Ed. You're
good. Thank you. So just a little bit about me. And Michael's correct. I have been with the study club almost since its inception, I think 1994. I was at the symposium that was on Lake Washington and in Kirkland, Washington. I think it was the second year. And have been a part of the family for many, many years. I actually still have from 1999 a vintage bottle of wine, which Michael used to give out at the meetings. The other ones usually were consumed on the plane prior to landing. Those have all disappeared. But I've been with the club for many, many years. In fact, I'm wearing my Seattle Study Club sweatshirt. You might notice half of my wardrobe is a circa 2000 Study Club wardrobe that Michael generously gave to us at the various symposiums. So a little bit about our club. We have 45 members. That's been pretty much sustained throughout our 28 years. Our tuition has not changed a great deal. We try to keep it very low, $1,400 to $1,600 per year. We try to make it manageable for our participants. New members to the club, we don't charge them if they're right out of school, and that's been a wonderful way of attracting young members. We also have a local general practice residency here in Rhode Island, and we make it very easy for those folks to attend our meetings, and offering them really either zero or very, very low tuition rate. And that's been a huge help. Our meetings are held at private clubs in Rhode Island. Excellent food, excellent location. Sometimes we'll use a local golf course, but we try to make sure that at the end of the day, we're providing a quality evening program with excellent food. People really appreciate the fact that they can come hang out with their friends, enjoy a wonderful evening. I have two partners, Dr. Thieberge and Dr. Pham. We have several offices, and Peter is correct. We have a dedicated coordinator who handles our programs. I don't think we could really run the club without somebody that is as dedicated. And Tina has been with us for a number of years. A little bit about personal. I live in Rhode Island, as was mentioned. I went to Emory and Penn. I grew up here in Rhode Island. I'm coming to you from a 101-year-old house with leaky ceilings and kind of a famous house. It actually has a history of being haunted, although we haven't seen anybody recently walking the halls, but it is the subject of a couple of films that were done many, many years ago. Scared the crap out of my daughters, I might add. Rhode Island's a great place. It's a small community. It's less than 1 million people. We have 400 miles of coastline in this tiny little town, but we're not it's not a very rich or wealthy community, but it is a community with a very active dental, an active number of dentists. And I think I'm going to reiterate what's already been said so many times before, and that is that the club provides an opportunity to establish relationships. And as a result of that, over the last 28 years, there's no question that we have grown, that we are continuing to grow. We're extremely busy. And probably most importantly, we've established ourselves as something different than just a periodontal office. We have established ourselves through the study club, I might add, no question about it, as the experts, as the kind of go-to people, the people that you can trust. And probably more than anything, I think, in growing a practice, is establishing that kind of a relationship, that one-on-one relationship, that relationship where somebody can come to you and trust your opinion, get an answer, and there's just no substitute for that. That's what I think has truly been remarkable about the Seattle Study Club. It is a form of branding, as David pointed out, as Peter pointed out and mentioned. And that's a very good thing when we talk about branding. We want to be branded as the educational office, the higher echelon office. And I can tell you that we ran a study club prior to joining the Seattle Study Club, but the study club provides something really remarkable. It provides the tools that allow you to do what you have to do. It allows you, it provides the tools that allow you to perform and present at a very exceptional level without having to reinvent the wheel. And I think that that's really, really come through. As I mentioned, before, there's no substitute, and we have found this after 27 years, there's no substitute for that one-on-one relationship that the study club allows you to create. By creating an environment, by creating a program, by giving a program, an exceptional program, you get to meet people one-on-one, and you can take that to the next level, whether it's through a phone call or a lunch or whatever. It puts you there. And I think that that's something that can't be underestimated. That's how specialists work. Specialists work by developing one-on-one relationships with individuals. And in doing so, that sort of makes you, and to do that, it requires a little bit of psychology. It requires a little bit of ability to find common ground with another individual. And of course, in dentistry, that's pretty easy to do since we're all dentists and we're speaking the same language. But I think that you've got to be interested in people. You really have to be interested. You have to listen to people. You really have to make sure that they perceive you as being on their team, on their side. You have to make sure that people understand that you're there for their benefit and you're listening. You know, one thing that I've come to realize, whether I'm having a meeting with staff or we're presenting a meeting or a meeting with individuals, there are really three components that always take place. And if I'm doing, especially if I'm doing an office meeting, and that is the three things are to recognize the accomplishments, recognize the good things that people have done, and to let them know that you recognize that. The second thing, of course, is to educate, which is what we do in our clubs. We educate. And finally, I end any meeting with motivation, motivating people to the next level. That's part of being a specialist. That's part of what we do in the study club. And I think that that's really, I can't underestimate the importance of building these relationships, of understanding these relationships, and to grow these relationships. You know, it's funny, I'm often reminded of the crazy story, you know, the story about the rabbi that is mitigating between two farmers, and, you know, Saul and Abe come to him. They both claim that they own this cow. And the rabbi listens to Abe, and Abe makes a very compelling argument that he owns the cow. And the rabbi ends up by saying, you know, Abe, you're right. I think you're correct. And then he listens to Saul, and Saul presents a compelling argument for why he should be the owner of the cow. And the rabbi listens and says, you know, Saul, you're right. Abe, you're right. I think you do own the cow. They both leave, kind of perplexed. His wife walks in and says, you know, you told Saul he owns the cow. You told Abe he owns the cow. He looks at his wife and he goes, you're right. I think you're right. You're right. And the point is that he's a listener. And I think that very often, as a director of a club, we have to listen, we mitigate, we pay attention to what people say. We try to problem solve for them as much as we can. I think that as a whole, we're educators, we're rabbis, we're psychologists. And I think that if we do those things and we continue to be the source, the answers, the concierge, I think that you can't help but grow your practice, and grow your practice well. When you're in it for people, whether they be your referrers or your patients, you can't lose. And the study club really has given me so much in terms of clinical didactic knowledge, and maybe most importantly, that panache, that ability to appreciate and love people. And I think that comes directly from the man who put this whole damn thing together, because he truly exhibits that kind of feeling. When you talk to Michael, it's like he's known you forever. And I think that that carries on into the club. And I think it's a marvelous thing. Thank you, Michael. Thank you, Peter. Thank you, David. And thank you, everybody, for listening. I don't know that I've given you a whole lot of information, but it is a little bit about, I think, 28 years of running a study club and why it continues to do so well. Thank you.
Well, thanks, Ed, and thank you for your kind words. Alan, I think what I'd like to do at this point is, number one, go to the Q&A section of the Zoom format here. There are a couple of questions, and then we can open it up for any additional questions that viewers would like to ask. I'm going to look here for a second and see. Okay, so the first question I'll have Ed address, and I see that 3 questions have been answered already, but I really would like the people who are tuning in to this to hear those questions as well. And let me go to them. One of the questions was by Dr. Horowitz, and I don't see it in the Q&A. So Dr. Horowitz, can you, is there a way to get him to be able to ask the question again?
I have it here. You want me to read it out?
Yeah.
Okay, it looks like, I think this was addressed to David, but if anyone can answer it, I would also assume you are including ROI as a metric in success of your study club in practice. How would you determine your ROI based on the time you are putting into your study clubs? Anybody can answer this.
I'll give a shot at it. So it's a little bit difficult. That's a great question, Robert. So it's a little bit difficult to put an exact number on the ROI, but I think really what he's asking is the juice worth the squeeze? You know, how much investment do you put into this, and how do you know you're really getting anything back to it? So, or back from it. You know, like I said, we opened our study club at the same time as we opened our practice. So as the practice has grown, the study club has been pretty reciprocal in that, and vice versa. You know, I have a 19-month-old now. Priorities have changed a bit in my own personal life. And so one of the things we did was, or one of the things I looked at was where it was worth spending my time and then letting go of the things that weren't. So part of the micromanaging of these different clubs that we've started, I've really let go of a lot of that, but I've actually invested a lot more time than I was in terms of focusing on the type of curriculum that we would provide. You know, we figure out who our speakers are going to be. That's the very last thing we decide. We put the majority of our time is spent on figuring out what our members, what their needs are, what they're interested in, what is popular, what is going to have traction, and then we kind of reverse engineer from there. And we use the Complete Curriculum 3 most recently as a toolbox to do that. So I don't know if that really answers this question in terms of ROI, but it gives you an idea of where I'm putting my time and where I'm not.
Just for information, how many members do you have in your regular study club?
25 members. We have about 5, what we would call, you know, vendor type support folks, but in terms of member doctors, it's about 25.
Michael, do you want me to read the other question on here, or do you want to get into the?
There is let me just see what I see here. Peter has answered one question related to, are the treatment planning sessions done on stock cases? And the answer to that is, although Peter has his own answer, and that is that they do both. They have members or advisory board members who contribute cases, and Peter contributes cases, but also Seattle Study Club has over 100 standardized cases which are available to clubs. And we also do live stream treatment planning sessions, which can be very valuable because it really gets members engaged and involved in treatment planning. But Ed, why don't you give us your thoughts on that?
Can you repeat the question again?
So the question is, do you
I was thinking
use
my own question.
do you do treatment planning sessions, and where do you get your cases?
We do treatment planning sessions. I mean, treatment planning sessions, I think, are the backbone of the club, and 9 times out of 10, I provide them.
Okay.
We'll do the documentation. We'll do the and, you know, having a seasoned club as we do, we're also able to go back and look at some of the cases that we treated years ago and present some of those results. I find it very worthwhile to help. It's another way of bonding when we come up with the photographs, and we can talk to the doc, and we can refer doc and really engage them. We have them help us present, although we do 90% of it, but we like to do our own documentation.
The Seattle Study Club has treatment planning sessions associated with our symposia. And we have actually our clubs develop teams They field teams, and we have something that we call the World Championship Team Treatment Planning Competition. And we've done that 2 or 3 times, and now it seems that cases are involved every year in our sessions, and they have become very, very popular and a signature for what the Seattle Study Club is. And the reason we do that is because we are so invested in the idea that our members have an opportunity to test their true understanding of what they learn in dentistry during these treatment planning sessions. So we'll move on to another question. And that is, how are you recruiting new members, Peter, for your farm team?
Right. So one more thing, actually going back to the treatment planning, what I think is really important to use the technology now that we have, the CBCT and iOS, and work with your study club members, compiling the data, whether you do it at like a treatment planning evening or you do it just separate, it really helps. I think that's a really treatment planning and helping the dentists get the data together. It really benefits your practice tremendously. For the farm team, comes to kind of just having a pulse on the community. I think, you know, my treatment coordinator, or my Sydney, who my CE coordinator, she knows who is in the community, if there's a new dentist coming in, or you know, and that's how we reach out to them. That's one way. There is at the local dental school, and Adam, our junior partner, is teaching them one day, so he connects with them. People do know about the study club. They'll approach us directly. And the final way is, so if someone joins a dental practice and the senior partner in that office is already part of the study club, they'll approach us. And that's a nice way of just saying, hey, you know, why don't we start in the farm club and we'll raise you to a certain level. The question about the retention, I don't have any data yet because this is going to be a second year.
Okay. And did you answer both questions there? Yes, you answered the farm team, and you had comments on treatment planning. Alan,
Michael.
I wouldn't mind you chiming in as much as you're running a club and you listen to all of these directors and saying what they said. What are your thoughts on all of this and the future, tying the future of your referrals to running your club?
Well, it has been more challenging as we're in our 24th year. And one of the things I want to address to Ed, I guess, and everyone else is that the challenge has been the new members. We have a longstanding club. We were at one point close to 50. I think now we're about 25. So 25 is a good number, but I feel like we've slipped down the slope, and I've been challenged. It's been challenging to get the millennials, if you want to call them that, to commit to this much time. So we've kind of changed the amount of full day programs, and we have more evening programs because of that. So I was curious with Ed and others, have they seen David's more on the going up, upward slope, and Ed has more seasoned group. Have you seen similar challenges, and have you maintained your numbers, and how are you doing that? I'd like to learn from you on that, if anybody wants to chime in.
Yeah, I agree with you, Alan. It has been much more of a challenge. I think that it gets a little bit confusing because we've had 2 years of COVID, and COVID really took the the steam out of our program. People kind of cut back. They found that, hey, not so bad being home, what have you. But interestingly enough, I was really surprised by the interest that's been shown post-COVID. Our numbers aren't quite as big as they were, but they are definitely on the upswing. People want to be back together again. Although we have a number of patients a number of participants that are still not comfortable being in group settings. I don't know if you've seen that at all, but so a lot of them choose to attend via Zoom. But again, I think that the bottom line, there are lots of excuses, but I really believe that the bottom line is perseverance. You put in the time, you put in the effort, you put in the program, you get as excited as you were about it when we first started this, they come back. I think that participants really pick up the vibe. And sometimes it's a little hard after 28 years, 30 years to, get done it, been there, what have you. And of course, we've got a lot of guys that have been with us for the whole duration or almost the whole duration to keep their interest alive. It takes a little bit of effort, but it's worth the effort. If our numbers drop in half, that's okay. We're still going to run a club and get a lot out of it. So there's no question. It's a little more work. It's a little more perseverance.
Ed, so you're going to run a club anyways, even if you have half the members. Why is that?
Well, I think it's part of our psyche. It's part of our brand. It's part of who we are. It's part of our DNA right now. It keeps us young, keeps us fresh. It keeps us thinking. Very easy to just go into the office, do your thing, go home. If it comes to that, it's time to wrap it up. You give up teaching and learning. As soon as, like a shark, you give up moving forward and learning, maybe that's time to hang up your spurs.
Thank you. And David Lee or Peter, do you have any closing remarks?
I think we've covered everything. Appreciate the chance to get to hear you guys.
You didn't cover the Tar Heels.
We'll wait till after Friday. We'll wait till after Friday. I've learned not to say anything, but this year.
Michael, can I interrupt you for a minute? I'd like to, if I may, invite Sam Bakuri for a moment. He is also a study club director. Sam, are you there somewhere? And he has a oh, good. We don't see you though. Sam has a pretty large, there you go, some large study club. And he has some very interesting concepts. I think it might be, if you're okay sharing with everyone, where you've taken your group and your genius bar and
Sure.
Spend a few minutes.
So we have one of the also, I think our study club starts the same year Ed started it. Mark Weingarten and him were together in '94. So we have members that's been in the study club as long as Michael Cohen has been in it. And we also have members that attended the first symposium where I think Moses gave great remarks about escaping Egypt. And that was the opening of that. So we have a long-standing study club, but I will tell you that the study club went through stages. There was a stagnation where people start thinking like it becomes a social event where they come in to see friends. But then, I start bringing new dentists and they look and there is a big age gap between the existing members and the new ones, and they feel it's hard for them to belong. And what I did is I started a young dentist study club for 3 years. And what I did is after the 3 years, I just transferred everyone to the Seattle Study Club and closed that. And I have an associate who's going to start a new one. And this way we can replenish members with young ones. And the treatment planning session is a key. So we have plenty of that. And we did the concept of old SIB, young SIB, where we pair up young dentists with seasoned ones. And we give them the assignment of presenting a case together with the young dentist in charge of collecting all the data, and the seasoned dentist is in charge of presenting. Because the young one is good with technology, the seasoned one is very well versed with all the information needed. So that was very helpful to get the attention of young members, and also involve them with surveys about what kind of speakers you want to hear, what kind of meeting you want to have. And I think that was effective in my area, at least, to keep Seattle Study Club very appealing argument for dentists. And they actually, tell their friends. So there are people who I don't know, but they come ask me if they can join Seattle Study Club because their friends are members. So it's just exactly like what Ed was saying, is creating the culture. And once you create the culture, it's a lot of people want to buy into that culture.
Yeah.
Michael, we have two more questions. I don't know if you see it on your screen.
Okay.
Thank you, Sam. Thank you.
So, Neil Starr. Michael, what are the director's perceptions on the growth of their members vis-a-vis interdisciplinary treatment planning and execution? Have they been effective in preparing their cases more comprehensively? I would say that in the very beginning, it was really difficult based upon the fact that there weren't many doctors who were documenting to the point where they could contribute cases for interdisciplinary treatment planning sessions. And that's why the Seattle Study Club has come up with cases that our directors can use. Are they being used? The answer is probably yes, because our directors are getting them from us specifically for those sessions. Now, I also believe that when we look at just what people are doing in their programs, and many of them now are doing the complete curriculum, the big draw seems to be the treatment planning with the experts, and many of those cases are interdisciplinary cases. So I really do believe there, over the past decade, the interest has grown significantly for treating cases comprehensively. I think that every director will also tell you that they have dentists in their club that still think tooth to tooth. And it's a challenge for us. We have to deal with that and figure out how to get around it. So it's not all peaches and cream, but by the same token, Neil, we have really made great strides there. The next question is directed towards, I think, David Lee. Am I right,
Yes.
Alan? What's an example of 4 seasons service?
It might not be what you think. It's not walking into the study club and getting a glass of champagne, though we do offer that. Todd Williams went through, he's someone that's been associated obviously with the Four Seasons Hotel. And one evening he went through with me what it kind of means to have a Four Seasons experience. And in a nutshell, what he talked with me about is that it is a very close examination of every single aspect of what you are doing, and does it have meaning, and is there accountability with what you're doing. And so that conversation actually was more about my practice than it was the study club at the time. And I mean, our practice was doing great. We were growing, and we made some changes. Despite growing, we wanted to really look at every single aspect of the patient experience and also the experience with our referring doctors. So we kind of it took a lot of mental effort, to be honest. It took some consultants and coaching, and we're still at it. But we took that same philosophy, we applied that to the study club, and that's what I mean when I say the Four Seasons experiences is it's a lot of upstream thought that goes into bringing what we hope is the highest level of education in our area, because we've been flooded and inundated with the ability to sit at home. Basically, you have to beat the convenience factor with this. And the convenience factor is you can stay at home, you can get on your MacBook, you can watch a Zoom, and you can get fairly high educational content that's readily available. And so our goal was to offer something that couldn't be matched on Zoom. And it took a lot of thought. And that's what I would call the Four Seasons experience, is look at every nook and cranny of what you're doing with your programming, what you're doing with your connecting with your referrals, which is why I let go of a lot of the micromanaging of stuff with the other aspects of the clubs.
And you're still having Sam come lecture to your group? No, I'm just kidding.
He's a key member. He's a key part of it.
I think
Sam's great.
I think it's important to recognize that from the very beginning, I wanted a Four Seasons experience at every one of our symposia. And I think the Seattle Study Club symposia have developed sort of a reputation for that. So it really is an experience beyond just going to a meeting and listening to lectures. The reason that I'm saying this isn't because I want to promote the symposium or symposia. It's because the reason that we do it is we want it to trickle down into all of our clubs, that our directors will aspire to provide the highest level of continuing education and service to their dentists on a yearly basis. So there's a reason for it, and there's a reason why most of our meetings are either at a Ritz or a Four Seasons. So there you go.
Michael, you have a new question up.
Okay, let me look here. How do you connect with the young dentists who are practicing in DSOs, which have come to predominate in my area? They have to practice within the parameters of the DSO management. I will let any of our directors, including Sam, answer that question.
I can answer it. I deal with a lot of that. Basically, what we do is we approach the DSO. There is two big DSOs in our area. What we did with them is we establish a specific program for their dentist, and we tell them that there's gonna be a free program. We train them on clinical stuff and then treatment planning. And then as part of this, we invite them to the treatment planning session of the Seattle Study Club. So if you just go and approach them and give them brochure of the study club and free invitation, they're not gonna show up. We learned that the hard way over the years. So they have to see the value to believe in. And we do that through like a plan, and I will be happy to help the individual who's asking on developing a DSO specific plan, which is basically a couple lectures, including treatment planning session. And part of it is the treatment planning session of the Seattle Study Club as like to be continued experience. And that was very helpful. We have something called Dental Cafe in our office. And there is a lot of cases that if it's very involved or very interesting case, we move it from that in-house treatment planning session into the Seattle Study Club one. So this way we ensure the attendance of everyone, and we tie that in-house treatment planning sessions into the Seattle Study Club, that we don't even offer CEs for it. So and it's mainly for the Seattle Study Club members and guests. So it becomes like, if you want to get introduced to this concept and involved with that, you're definitely going to have to join the club. I remember I sent Michael Cohen an email in April of 2020. And I said to him, this is great. We're going to do Zoom. I don't have to worry about how much this downtown hotel going to charge for parking. I'm not going to worry about the flight of the big speaker or how much his honorarium are we gonna offset it? We can just get Zoom, and we will get big speakers for way less, and people will do it in their pajamas, sitting in their houses. And I remember Michael Cohen responded to me saying, there will always be a value to leaning on to the next person sitting in a meeting with you and ask them a question. And that proved over the last 2 years to be absolutely true. You know, there will always be value. Seattle Study Club, one of the great things that offer is continuous exposure of us to the referrals. And it actually, you know, a lot of DSO kids, like, you know, they vanish from the DSO and they show up somewhere else. So they look at, you know, the Seattle Study Club as a job opportunity for them to introduce themselves to well-trained, you know, dentists and big names. So a lot of them actually taken this opportunity, but it has to be presented in a way that the DSO has to push them to attend.
Mhm. Good.
I'd like to add a little bit to that. And as you all know, I've been putting together programs in the next year with different DSO models and different specialists that work for DSOs, some that had a good experience, some that did not. So that'll be coming up next year. You have to join now. But with that said, there are different DSO models, just like there's different dental practices, different levels. And some of these models, they have to stay within the network and some do not. So you want to find out what model is in your area. I guess this was for Joe who asked the question. And if they're locked into that certain referral, that's more challenging. But a lot of some of the DSOs do not change the model of the practice. And those are the ones you want to go after. I know Michael's on a time constraint. I'm going to let him wrap up with however he wants to.
Well, I think that a lot of what I said in the beginning holds true. And that is, you know, obviously we see what's going on in the world and we may not have a lot of control over it, but we certainly have control over our own worlds. And I think that it's been proven out over the last years with COVID, these recent years. It's been proven that individuals can come out of the worst situations and still prosper and still thrive. And that's exactly what we're seeing. And we're sitting here tonight because we're the individuals who are interested in leading to the results that we want to see. And I think that's part of history, and it is absolutely part of the future. We just have to use our own devices, our own creativity, our own innovation to make it happen. So I want to thank you, David Lee and Ed and Peter, for spending time with us this evening. And Sam, thank you for joining us and participating in the discussion. And Alan, as always, thank you for having me. And if there are individuals that are interested in starting a club, I think the Seattle Study Club is a great way to go. And you can email me at michael@seattlestudyclub.com. It's really simple, and I am very good at responding. So take care, everyone, and have a great evening.
Thank you. Thank you, Michael. And
Thank you.
thank you, everyone, for joining us. Please join us next Wednesday night. Another great iADS program, and this was great. Michael, I'll speak to you soon. Thank you all, panelists, Ed and David and Peter. Have a great
Thanks, Alan.
evening, everybody.